Down syndrome is a genetic chromosomal disorder uh, causing developmental and intellectual uh, delay in people with this uh, problem. It is a genetic uh, chromosomal disorder that is caused by an abnormal cell division, resulting in extra genetic materials, at chromosome uh, 21. Uh, Everybody usually have a pair of chromosomes. Well, we have 22 chromosomes genetically. Each person will have 22 chromosomes. And this chromosome comes in pair. Everybody will have a pair of each chromosome. So, and let's label it from 1 to 22. But in Down syndrome, at chromosome 21, number 21, instead of having two, then they carry three chromosomes, and that is what we call as trisomy, you know. The condition cannot be cured, but treatment and therapy can help with early intervention.
Hmm.
And in responding to your question, what is the difference between um, Down syndrome, people with Down syndrome, with other people with special needs? First, Down syndrome, as I mentioned earlier, is a genetic disorder, which uh, because of the uh, problem with the division in meiosis, and then you realize that at position 21, there is what you call trisomy instead of diploidy. So you're having trisomy 21. And mostly they present with speech problem, uh, delay milestone, and they also have uh, mild to moderate to severe intellectual uh, disorder. There are different other special needs like autism, and each one have their own uh, peculiarity and specificity. But mostly, the uh, when it comes to Down syndrome, it differs from others because it's a genetic uh, problem, and uh, mostly they present with developmental milestone, which also affect their intellectual and developmental uh, activity.
Hmm. All right. Thank you very much, for giving us an overview of what Down syndrome is. Now, it's 15 minutes after 10. And of course, you can dial the number 07000 Send us a text or a WhatsApp message on 070 Those are the numbers to get in touch with me this morning. Or better still, you can go to your Facebook and Instagram. We're live at WFM 91.7. Get to watch us there, and of course drop your questions or concerns too. Okay. And then of course we have Dr. Akin Ola with us this morning, who is a consultant pediatrician, and of course she's talking to us today on Down syndrome. My name is Rose Yusuf Kaiser. Now, she has just given us an overview of what Down syndrome is and how it is different from other special needs for children. All right. So, Dr. Kinola, I know in the process of Ted giving us an overview, you actually mention some characteristics that have to do with Down syndrome. Now, let's probably dwell on that a little, and how early can this be recognized in children? How early can this be diagnosed? Now, what are some of the common physical characteristics of Down syndrome that one should look out for, especially during diagnosis?
Um, with modern facility, improving technologies, and where the facility and equipment are available,
Hmm.
Down syndrome can be diagnosed in utero. I mean, uh, when the child is still during pregnancy, it can. I mean, in developed country, uh, Down syndrome can be diagnosed as early as when the pregnancy is as 3 months old.
Hmm.
You know, there is a process or procedure. That you know they encourage pregnant women to come for the procedure. Uh, Amniocentesis, which diagnose uh, Down syndrome early, as early as 3 months,
Hmm.
uh, where the facility uh, and the technical know-how is available. But uh, in this part of the world, with a pediatrician should be able to make diagnosis of Down syndrome as soon as the baby is born,
Hmm.
because they have a typical facial appearance, which is uh, more classical for people with Down syndrome. And so you should be able to, a pediatrician that knows what she is doing, he or she is doing, should be able to make at least uh, be able to make the diagnosis, physical diagnosis, before confirmation with is done uh, for Down syndrome. So with karyotyping will make the final confirmation. Uh, when you do the karyotyping and is able to confirm that there is a trisomy at chromosome 21. But physically, uh, as soon as the baby is born, during physical examination, a a, a pediatrician that knows what he's doing should be able to make diagnosis of uh, Down syndrome. As I mentioned earlier, people with Down syndrome usually have an IQ, that is the measure of uh, intelligence,
Hmm.
in the mild to moderate to low range, and are slower to speak than other children. So other common physical features that you notice in them are flattened face, especially at the bridge of the nose. You call it. They have this flat face at the bridge um, of the nose. Flat describe as uh, flattened nasal bridge. Then they also have this almond shaped eyes that slant up. Like the eyes slant up. Like when you have typical description is when you are seeing the eyes of the Chinese people.
Hmm.
Slant up. So they also have short neck. Some of them, notice short neck. They have small hair. Then they have a tongue that tend to stick out of the mouth. You know, most of them, especially when they are babies. They tend to stick out their tongue out of the mouth. Uh, they also have this typical small hand and feet. Then you also an examination. Some of them will have what you call single palmar crease, in which there is a single. When you look at uh, most people, when you look at their palm, you have this line, you know, where you fold the when you fold your your fingers over your palm, you know, you notice these lines. Most people will have three lines, which you describe as palmar crease. So people will have two, but when you notice one palmar crease, rather than having two or three, you have a single one. Is common and typical of people with Down syndrome. Then some of them we have this small pinky finger that sometimes curves toward the thumb. Uh, most of them we have as a baby, they have poor muscle tones or loose joints, and as they grow up into teenagers and adulthood, they tend to have shorter heights
Hmm.
when compared with children, teenagers, or adults of the same age.
Hmm. Okay. All right, thank you very much. And these are things that one could actually, from the first sight, will be able to pick out all of these characteristics if you're very careful. So, is it possible that some children could have some of these characteristics and yet would not be, would not have Down syndrome? Is it possible? And to an extent, they get to they get to outgrow some of these characteristics that you've mentioned.
Yes, it's possible that some of them may have feature showing one or two of these characteristics, and yet they don't have that syndrome. For example, it's not everybody that is short,
Hmm.
you know, or everybody that stick out, every babies that stick out their tongues have Down syndrome. Um, or every babies that have poor muscle tones have Down syndrome. There may be other condition that is responsible for some of these characteristics. But when you are saying one, two, three, four, five features
Hmm.
of these characteristics, I mean of these features I've mentioned, coming together in single person, please have a high index of suspicion that this child may have Down syndrome. But what finally confirms it is when you go to do karyotyping, it's a genetic test. This will confirm that this child have chromosome. I mean, have trisomy. I mean, in triploidy in in chromosome 21. Rather than diploidy that every other person carries.
Hmm.
That's the final confirmation for Down syndrome. And I also mentioned earlier,
Hmm.
in a developed country, there is a process which is, you do uh, chorion sampling and through amniocentesis, that you'll be able to make early diagnosis of Down syndrome.
Hmm. Okay. All right. Thank you very much, Dr. Akinola, for giving us these characteristics and explaining them to us. All right, 26 minutes after 10. And of course, this is the program Radio Doctor, your free health consultation program where real doctors advise real people. My name is Rose Yusuf Kaiser. And of course, today we have a consultant pediatrician from St. Ives Family Hospital, Dr. Olufumilola Akinola. and of course, she's talking about she's consulting and advising on Down syndrome this morning. So do all to call in with the number 07000 Send me a text or a WhatsApp message on 070 317 All right, let's get to hear from you this morning, your thoughts, your concern, and of course, whatever that comes to mind as regards Down syndrome. The doctor is here to attend to your concerns, your question, and probably to clarify anything that you have heard. Because there are a lot of myths out there when it comes to Down syndrome. So I'm sure that you would want to clarify that with the doctor this morning. Okay, so don't forget we're also live on Facebook and on Instagram too, WFM 91.7. You can also go ahead and drop your questions, your concerns, or anything that comes to mind as regards to Down syndrome this morning. All right, doctor. So thank you so much for giving us all of the information you have just given us this morning on Down syndrome. Now, earlier you mentioned that this has to do with genes. All right, this has to do with some form of genetic basis, or how am I supposed to put that now, going on for Down syndrome. Now I'm sure that a lot of parents or maybe mothers to be or a lot of people who are listening right now might be wondering if, okay, this has to do with genes now. To an extent, you might not be able to control this. So, but is there a way, or is there something that we can do to prevent this from happening? Is there anything outside, something where we can control, as regards to Down syndrome, that we prevent this from happening?
Um, when it comes to Down syndrome, sometimes, like I mentioned earlier, that
Hmm.
it is a genetic disorder,
Yeah.
and which happen at uh, due to uh, chromosome 21 uh, carrying triple chromosome instead of two that other normal people carry. And when it comes to chromosomes, there are small packages of genes in the body. They um, determines how the baby body forms and function, and how it grows during pregnancy and birth. You know, typically a baby is born with 46 chromosomes. You know, when you talk about total chromosomes in the body. But babies with Down syndrome have extra copy of one of these chromosomes, at position chromosome 21, which is a medical term for extra copy. The medical term for the extra copy is known as trisomy. So Down syndrome is also referred to as trisomy 21. This extra copy changes how the baby uh, behave, growth, and develop. And it also leads to the physical features and the developmental challenges that occur in the people with Down syndrome. So most of the time, you don't have control, as a parent over maybe if your baby will develop um, Down syndrome or may not. What we know is that it's more common in babies uh, from older parents,
Mm.
especially if the mother is older than 35 years old.
Okay.
The older the baby, the older the mother, when you carry the pregnancy, the higher the risk of having a baby uh, with Down syndrome. That is an established fact.
Hmm.
But however, we also realize that recently, even mothers that are younger than 35 years old are also uh, having babies with Down syndrome. So there may be a lot of uh, things that come to play when it comes, to having this, which increase the chance of a parent or you having a child with Down syndrome, apart from the older the mother,
Hmm.
at least, but that is the one of the established facts that has been that research, which has been established through research. But probably we don't also know, maybe some environmental factors may also come to play. But a lot of research is still going on, and and which probably in future may be able to also help us to determine what other risk factors also increase the chance of having a baby with Down syndrome. But a child with Down syndrome, I mean, a mother with and the older the age of the
Hmm.
mother, the higher the risk. That is an established fact.
Hmm. Okay. All right, thank you so much, Dr. Kinola, for that. 28 minutes to 11, right here on Women Radio. And of course, we are still talking on Down syndrome. So do well to send in your text or your WhatsApp message on 07031756537. Okay, go ahead to call us on 07000 Go to our social media platforms and drop your questions, your concerns. We're definitely here for all of it. The doctor is here too to answer to all your concerns. Right, my name is Rose Yusuf Kaiser, and this is Women Radio WFM 91.7, Nigeria's first radio station for women and their families. All right, doctor, now how does early intervention programs benefit children with Down syndrome? Because for a lot of cases like this, or maybe different illnesses, we've heard a lot of, doctors who come on this platform and say early intervention is key, early presentation is key. So is that the same thing too for Down syndrome? How does early intervention, programs help with Down syndrome? And once a child has been diagnosed with Down syndrome, what are the first steps that the parent should take? Because at the end of the day, when the child has been diagnosed with Down syndrome, for the parents, that is the early stage that he or she is getting to know about it. So that is when he or she will be able to take action, the right actions towards a Down syndrome. But how early, or rather, how can early intervention help? And of course, what are the next few steps for the parents to take or guardians to take?
Thank you very much. Down syndrome is a lifelong condition. So, early therapy or service, early intervention program, you know, we often help babies and children with Down syndrome to improve their physical and intellectual abilities. Most of these services focus on helping children with Down syndrome to develop to their full potential. These services include speech, working with speech therapy, occupational therapy, physical therapy. They may need to go and to see the optometrist, for their visuals. May need to go and visit ENT doctor, for their hearing.
Hmm.
They are typically offered through early intervention program, you know, where this is well developed. I mean, in country where this are available, it's a package, for these children with special need. They have physical therapists that work with them, especially for those that have poor muscle tones, that have a delay in walking. They will need assistance of physical therapists to work with them so that they will be able to uh, help in walking. May need the help of speech therapists. They usually have speech delay. A speech therapist and language therapists will work with them to be able to help them to be able to achieve, this, I mean, overcome the speech delay. And some of them will also have to work as they get older. Occupational therapists, they'll be able to understand them, follow them up and know their interest. And with this, they'll be able to channel them to the way which may be able to help them to be able to be independent, at least to some sort as they grow up.
Hmm.
So these are the uh, importance of early intervention therapies. So uh, where there is challenges or where they need help, you're able to pick it early, and give help, to them so that they be able to uh, achieve their potential and lead a good quality, uh, have a good quality of life.
Hmm. Okay. So what I hear you say is that with any intervention, they could actually go ahead and live life, have good quality life process, and just be as normal as every other kid. Is that possible with early intervention and with all the necessary
With
therapy?
with with early someone that have early intervention therapy,
Hmm.
we have a good quality of life.
Hmm.
We'll be able to achieve a higher potential than someone that doesn't have any.
Oh.
They
Hmm.
may not be totally be what will I call it? They are intelligent. I mentioned they have speech delay,
Mm-hmm.
developmental delay.
Hmm.
They also have uh, intellectual disability.
Yeah.
But you don't know how far these ones can go if you don't expose them early, to all these opportunities. So at least so that they can get to the best that they can get to, the earlier you start, the better.
All right. Thank you very much, Dr. Kinola, for that this morning. This is Women Radio WFM 91.7, and this is the program Radio Doctor, your free health consultation program where real doctors advise real people. All right, so do well to call in via the number 07000 Send us a text or a WhatsApp message on 07031756537. Let's get to hear your thoughts, your concerns, your questions, and maybe there are some things you have heard, on children with Down syndrome that you would want the doctor here to clarify for you. Because if you have the right information, then you would be able to debunk some of this myth that you get to hear about Down syndrome. So, do what to call in on 07000 Send us a text or a WhatsApp message on 070 All right, this is Radio Doctor right here on Women Radio WFM 91.7. Okay. So we have a text message here, a WhatsApp message, and I think this is from Matthew from Oyero Ijoko, and he says, "Good morning, doctor on WFM. What is the difference between Down syndrome and autism?" Okay, so he wants to know, and I'm sure earlier the doctor mentioned some differences between Down syndrome and other cases of special needs, but he's asking what's the difference between Down syndrome and autism. So, quickly, doctor, probably we just have to revisit that again. Before we take the
Okay,
next question.
thank you very much. I mentioned earlier that Down syndrome is a genetic chromosomal disorder,
Hmm.
uh, which the problem occurs at chromosome 21, in which it carries three um, chromosomes rather than two, which is common for normal people. And because of these extra chromosomes at position 23, that is why we describe Down syndrome as trisomy. And it is what is responsible for this physical appearance and developmental delay and what do you call, intellectual disabilities that are common with people with Down syndrome. So it is a genetic disorder which results in the physical features that is common to them, and also developmental delay and uh, and intellectual disability in Down syndrome.
Hmm.
But people with autism, it is a problem with communication and social interaction. So for now, uh, no specific no specific gene, you know, is uh, has been identified for autism. But the problem majorly have to do with social interaction and and verbal, language communication with others. So most of them they have problem with speech delay too, uh, just like people with Down syndrome. But they also have problem with social interaction, which differs in people with Down syndrome. They do have problem with social interaction. Rather, they are more like it's social butterfly. You see them try relating with people, hugging people. I mean, people in with Down syndrome, but people with autism,
Hmm.
they are sort of socially. They don't interact, alienate, themselves. They prefer to work to to play alone. I mean, especially in children. But you see, children with uh, Down syndrome relate well with people. There are a lot of other features which you can't start discussing now, but
Yeah.
just know that when it comes to autism, they have problem with social interaction,
Hmm.
with communication, and but in Down syndrome, they don't have problem with social interaction. They interact with people. They may have developmental delay, language expression, verbal communication too, but at least uh, mild to moderate, may not be as severe with some. Because also people in autism also have, uh, can also classify them with mild, moderate to severe. But majorly the problem that what distinguish them is Down syndrome is due to chromosomal abnormality,
Hmm.
while autism is not due to chromosomal
Abnormalities.
abnormality.
Hmm. Okay. All right. Thank you so much, Doctor, for that. Now, let's take another WhatsApp text, another WhatsApp message. And this one is saying, how long does it take Down syndrome child to match up with his or her colleagues verbally? And is there any home remedy to that? So the doctor has also spoken about this, but because you asked, so I think doctor would just try to go back a bit to answer this. All right. The question says that how long does it take Down syndrome child to match up with his or her colleagues verbally? Any home remedy to this? Well, doctor talked about
Uh,
early intervention and therapy, but go ahead, doctor.
uh, a Down syndrome patient uh, matching up with uh, his or her peers
Hmm.
depends on a lot of factors. And the most important one is uh, the early intervention therapy.
Intervention. Hmm.
The earlier the child is, they work more with rituals, you know, uh, when they see things, or probably if they follow you, have someone to follow or someone to work with them. So the early they you you introduce them to uh, speech therapies, working with them, they are taught to know how to handle these patients, especially in developed country. They know how to work with them. They know how to help, you know, with their development. The earlier, the better, so that this child can reach his or her maximum uh, potential.
Potential. Hmm. Okay. All right. Thank you very much, Doctor, for answering that message from one of our listeners this morning. All right. This is Women Radio WFM 91.7. Let's get to hear from you this morning. It's 14 minutes to the or rather 15. It's 15 minutes to 11 right here on Women Radio WFM 91.7. And of course, we're still talking on Down syndrome. So, doctor, how, because I think this is really, really important when it comes to support. Our time is fast spent, but how can parents support their child's social development and integration within their community? Because we know that, outside the family, in fact, sometimes within the family, you could hear some sort of stigmatization going on. You could hear a lot of people who will come in with different views and different thoughts on Down syndrome and just want to tell you how to go about dealing with your child. And at the end of the day, a lot of it might come to your table as a consultant pediatrician. So, how do you encourage parents to support their kids with Down syndrome? What are the things that you tell them to hold on to and to do?
Um, I want to start by saying that children with Down syndrome may face, just like other children with special needs,
Hmm.
may face social stigma and discrimination, which can affect their self esteem and social development. Parents may also face judgment and negative attitude from others. This can be challenging for family who may feel isolated and unsupported. However, we notice that children with Down syndrome, they are sociable.
Hmm.
They like playing with others, interacting with others, you know, hugging others, and easily they feel drawn to other people, you know, compared to children with autism. So, but I will encourage mothers to allow their children to play, let them interact with other people, and let them play with others. And just as we have mentioned, the role of early intervention, please seek help for this kind of children as early as you know that this child or have uh, Down syndrome. You know, if I mean, take them to speech and language therapists. You know, especially for those that know what they are doing,
Hmm.
so that they can also they be able to help. If they need physical therapies, please, for those that are having problem walking early, they usually have developmental delay in walking, delay in speech. Please seek help. I mean, with specialists that can handle this area. And also, if you're able to locate school for special needs in your environment, let them start working with this kind of children. The earlier, the better, so that they can reach their maximum potential in life.
Hmm. Okay. All right. Thank you so much, Doctor. Now, are there other health challenges that children with Down syndrome could probably later in life come down with, or because this is a lifelong, you know, uh, um, um, special need that a child could actually grow up with. So, are there any illnesses that the child could be open to as he or she is growing as a child with special needs with Down syndrome?
Yes, I mentioned earlier that it's a lifelong problem.
Hmm.
So it's a chronic problem, and so some of the uh, health challenges that are common with them include hearing loss.
Okay.
So some of them may have, not all of them,
Hmm.
but some of them may have hearing loss. Some of them may have obstructive sleep apnea, which is a condition where the person breathing, they'll start breathing temporarily. The breathing is stopped temporarily while sleeping. So some of them are prone to ear infection, eye disease. They may also have heart defect. This is common in about 40%. It's a birth defect that common at birth. Heart defect, which may be identified in about 40% of patients with Down syndrome. And also, they may also we also notice that hypothyroidism, you know, low thyroid, it's common in children with Down syndrome. And other health conditions, they are also prone to, not all of them, but some of them, we also know that leukemia, it's the cancer of the blood, is also common in children
Hmm. Okay.
with, with Down syndrome. So ensure that your child is not far from his health care provider. There should be a regular checkup, and the healthcare provider that knows what he's doing should be able to, I mean, look out for some of these health conditions in this sort type of patient as when they come for their checkup. So check for ear infection, check for eye disease. Some of them, look out for all this so that they can have good quality of life.
Okay. All right. Thank you so much, Doctor. We've come to the end of the program for today. But before we go, let's have your final words on Down syndrome to parents and even to adults who might, or with to adults who are still experiencing Down syndrome. What is your, probably your advice to them, and even to new parents right now who probably just delivered of their child and they are seeing all of these changes and they don't even know what to do. Let's have your final words on all of this.
I would say that having a child with Down syndrome is not the end of life. I always tell parents, knows how you handle your child. The way you handle your child, the is the way other people help you to handle them. If you value your child, other people will also value this kind of child. Though some of you, there may be, because of ignorance, uh, as I mentioned earlier, may be associated with stigma, alienation. But as much as possible, please take care of this child, give them love, and the as we mentioned earlier, the role of early intervention, is very important. Seek help as early as possible
Hmm.
with your healthcare provider, which may be able to lead you to some specialist, speech therapists, physical therapists, um, behavioral therapists. That actually, uh, in a community or probably in a country where we have uh, this early intervention program well developed, it's a package,
Hmm.
which is a sort of a educational stroke health program put together for these um people with special needs.
Okay.
You know, uh, they will be able to have access to these therapies and also these specialists, that work with them, to be able to bring the best out of them.
Hmm.
So, but I hope, and also at this period, I'm also encouraging our government to look into you know, this, be able to help this sort of special needs children, not only with people with Down syndrome, to help us set up this sort of special needs education, that include this complete package. You have where they meet to meet their educational, social, and health problems,
Okay.
so that these children will be able to have uh, the best and have uh, be able to reach their uh, potential
All
and
right.
have good quality of life.
Okay. All right. Thank you so much. Thank you so much, Doctor, for being a part of our program today and for talking to us on Down syndrome today. Thank you so much, Doctor.
Thank you for having me.
All right. Do have a great week ahead.
And you too.
Okay, so that's it today on the program Radio Doctor. A very big thank you to all of you who called, all of you who sent in text messages, and of course, those who joined us live on Facebook and Instagram. A very big thank you for tuning in and listening this morning. Join us again tomorrow for the program Radio Doctor at 10. Thanks to the producer of the program, Aisha Sani, and the executive producer, Tomo Kewali Shunaya. My name is Rose Yusuf Kaiser. Do have a blessed and an amazing day ahead. Stay with us right here on Women Radio WFM 91.7. Good morning.
To sponsor this program,